Welcome back. My next guest is Dr. Greg Cooper, who is a neurologist who specializes in memory disorders. Welcome, Dr. Cooper.
Thank you.
Now, everybody worries when they get a little bit forgetful, do they have Alzheimer's? Tell me a little bit what Alzheimer's is, and is it just one disease or is there a bunch of memory troubles?
Well, Alzheimer's disease is one disease. It's the most common form of dementia. There are actually many causes of dementia, like vascular disease, Lewy body disease, other conditions. All of these are neurodegenerative conditions. They're conditions that lead to progressive degeneration of the brain. In Alzheimer's disease, what we're most commonly seeing is problems with recent or short-term memory, or really learning over time. But other conditions can affect language, they can affect judgment, any number of things.
Well, now, what are some other risk factors for Alzheimer's disease?
There are, and it turns out that the risk factors for Alzheimer's disease, to a large degree, are the same risk factors we see for vascular disease, heart disease, and stroke. So things like high blood pressure, diabetes, high cholesterol, smoking, sedentary lifestyle, all of those things increase our risk for Alzheimer's disease.
Age-related, I guess more older people than young?
It is. After we get past the age of 65, there's about a 10% risk, and that really increases quite sharply the older we get.
Well, now, people can get a little bit forgetful, but that doesn't mean they actually have something. Are there warning signs or certain memory problems that are worse than others that says, hey, man, I better get checked out?
Yeah, just minor or benign forgetfulness usually isn't something that we have to worry about. And this isn't perfect, but to a large degree, if we're the ones that are worried about it, it's probably not going to be something serious. If our family, if our coworkers, if our friends are noticing more and more difficulty with forgetfulness, then that's a time when we need to worry about it. And to some degree, if we don't recall the things that we don't recall. If I can't think of somebody's name now, but I can come up with it later in the day or the next day, that probably isn't a big deal. If I can't ever recall a conversation or doing something, that's a little bit more worrisome.
Well, there's not a test you can do. There's not blood work that you can do that says, hey, I've got Alzheimer's.
Right. It's really based more than anything else, first on the history. And it's very important to be able to take a history or learn about the symptoms from a loved one, family member, spouse, child, and then they need a careful examination. Usually that's not too big of an ordeal, but they need a general exam and they need some testing of their memory or thinking just in the office.
So if I don't want to get Alzheimer's, is there anything I can do to prevent it?
Well, there's not a definite strategy, but there's more and more evidence that a few things can help. Staying active physically, staying active mentally, staying active socially. All of those things reduce our risk of developing Alzheimer's disease. The details don't matter nearly as much as simply the act of doing it. If I enjoy reading, I should read. If I want to take a class, that can be helpful. Any form of exercise that I like doing, all of those things are helpful. And then it's just good general health care, watching my blood pressure, watching my blood sugar, watching my cholesterol. All of those things are likely to reduce my risk of developing a dementia.
If you do get it, what kind of treatments are out there?
Right now, the treatments are primarily symptomatic. That means that they're really aimed at just the symptoms, improving the memory, and to some degree helping preserve our memory. They come in two classes. They're medicines called cholinesterase inhibitors. These have been around for over 10 years now, Sept, Exelon, and Razidine. And then there's a slightly newer medication called Namenda that we'll often use. Those form the foundation. Beyond that, we'll treat symptoms that come up, or we may consider clinical trials if appropriate.
And in terms of the Neuroscience Center and Alzheimer's, you help treat the patient as well as bring in the caregivers to help them.
Absolutely. We have good evidence that helping support the caregiver is every bit as important for the patient as any of the medications that I can treat. So it's really important to look at really the whole family if we can.
Well, thank you, Dr. Cooper, for coming in. We appreciate it. We've had information about Alzheimer's, and we'll be right back after this message.